Hi, good evening, everyone. Can you guys hear me okay? Great. I want to thank you for taking the time out of your day to join us on this call. It's a great opportunity. The purpose of this call, as you know, is just to bring leaders with the faith-based leaders of the Haverhill community for an opportunity to just have an open dialogue, a discussion about the vaccine. The mayor is going to be joining us as well to talk a little bit about the initiative here in Haverhill and what we're trying to achieve as part of the vaccine rollouts. There's a lot of, perhaps rumors and uncertainty revolving the vaccine. And so I just wanted to, I was blessed with the opportunity to be able to work and bringing all of us together so that we can all just kind of talk and share about some experiences and answer any questions that you might have. So a little bit about myself. My name is Rafael De La Cruz. I've been asked to join the Mayor's Public Task Force as part of this vaccine rollout initiative. I'm also on a subcommittee that leads the public relations for the Mayor's Health Task Force. And I also work at Greater Lawrence Family Health Center as part of the Director of Community Support Services in providing healthcare services to some of the homeless population here in the Haverhill city of Haverhill. Joining us, we're going to have the Honorable Mayor of Haverhill. We have one of GLFHC's own Dr. Karen Marshall joining us. We have Dr. Diane Smith joining us. We have Dr. Eliada also joining us here this evening, and also Carmenza Bruff, who's on the Public Health Task Force as well, and also participates in the Public Relations Subcommittee for the Mayor as well. So without further ado, I'm going to ask Dr. Marshall to open up, and she'll give you a little introduction about herself. Just before we continue, everyone here has access to speak at any time. This is, again, nothing formal. It's a very informal meeting for all of us to get together. And it's really, my hope anyway, is to really just share with you guys the knowledge that we have that could empower you to give correct information to someone who may come up to you and ask you for information from your congregation. So without further ado, Dr. Marshall.
Hi, I'm Kara Marshall, and thank you so much, Rafael, for giving us this opportunity to have a conversation. And I hope that we can all have the opportunity to ask and answer questions. And I know from my end, I am looking to hear what you all as community leaders are hearing from your communities about, and from that to know how we can best serve our patients. So I'm Kara Marshall. I'm a family doctor. I've worked for Greater Lawrence Family Health Center for 20 years now, so for a long time. In addition to caring for my patients in the clinic, I work in the hospital. I do a few home visits. I work as part of the Healthcare for the Homeless program. And I'm also Associate Program Director of our Family Medicine residency. So I help in training future family doctors to work in communities like ours. So if you had asked me before March of 2020, I would have told you that I had seen a lot. I thought in 20 years here, through the opioid epidemic, with everything that has happened in the past 20 years, I thought I had seen most things that there were to see, and I was wrong. I had never seen anything like this. I would never have imagined anything like this. And it's seeing my patients struggling to breathe and fighting for their lives, and far too many of them losing that battle, and seeing what that meant to their families who were unable to be there with them has just been heartbreaking beyond anything that I had ever seen in my career, that I had ever seen in my life. And having seen that, I want to do everything that I can to keep that from happening to anyone else, because I've seen the devastation that has been caused in our community for our patients, for families, for all of us. And for me, while the vaccine is not 100% without risk, nothing is 100% without risk, including, for us to go out the door in the morning. It is safe, it is effective, and I really feel like it is our way forward in a way that we can help each other and our families and our neighbors out of this difficult time. And I know that there is a lot of mistrust, and there are a lot of reasons for that mistrust. And I just want for us to all be able to share what information we have, to answer questions where we can, to see what questions are out there in the community, so that we can all just work together to serve our community in the best way that we can during this time. And Diane?
Yeah, and so I'm Diane Smith. I'm one of the physicians who's younger, who had the privilege of being trained by Dr. Marshall, and I've been here since 2015. Kind of echoing what Dr. Marshall had said, the kind of in addition to just like the seeing how uncomfortable people are kind of passing away from COVID and the devastation from that, it was also remarkable to me the number of people passing away in a short amount of time, which has also been unprecedented. Granted, my career is a lot younger. And just, I think all of us who've been witnessing this day in and day out, when we finally had access to the vaccine, the hope that we all had was just very palpable. And, you know, I know for people who aren't like seeing the devastation at the same level that we are, I think that can be hard to appreciate. And so I'm hopeful that other people will be as warmly welcoming of the vaccine as those of us kind of seeing COVID day in and day out have been. I'll also, I guess, mention I'm a member of Lawrence Evangelical Church and have been kind of with them since 2016. And yeah, but glad to be here tonight and to answer any questions that come up.
And I realize I left that out as well. I'm a member of North Parish in North Andover and have been since 2001. And with that, Dr. Ada, Eli.
Hi guys, my name is Eli. I grew up in Barnes and Methuen. I was born in 1990, grew up right on the sort of corner of Willow Street and Hampshire Road, which is one street in Methuen and one street in Lawrence. I went to public school in for K through 12 in Lawrence, and then high school in Methuen. And then I went to North Andover for undergraduate, and then Michigan for medical school. And I'm back happily doing my residency at Greater Lawrence Family Medicine, or Lawrence Family Medicine residency. I'm a member of St. Anthony's Church. My parents immigrated here in the 1990s from Lebanon, and we've been a member of that church and that community since then. So I can only echo what Dr. Marshall and Dr. Smith have said. The vaccine came and sort of gave us hope again and gave us something that we could look forward to in the future, where all we were seeing for 9 months, 10 months of COVID was despair and sort of hopelessness. So I'm happy to answer any questions as well. And thank you for meeting with us.
Thank you, Eli, Dr. Marshall and Dr. Smith. I just want to, reiterate, this is an opportunity to just really have an open discussion with our doctors, and the best thing that we could provide in helping to equip our community is knowledge. And we have amazing, clinical staff online, right? Here, part of this meeting that can help to answer any questions you might have regarding the vaccine. Perhaps you yourself have been impacted in one way or another, having a family member that may have been infected with the vaccine as well. So there's a lot of skepticism about the efficacy of the vaccine, and there's a lot of questions out there about, perhaps rumors that we're hoping to demystify with this during this meeting. And so, I want to give you guys an opportunity to just create an open dialogue with our doctors and see if you have any questions that they may be able to answer. And if not, I will promise you I'll find a way to get an answer for you if we can't get it for you during this time. The floor is yours. Feel free to ask any questions.
I don't know, we're happy to start with, we can start with how the vaccine works, or we can just start with questions. I am looking to see what you all need for your communities and what you're hearing from from the communities that you serve?
I guess I could start. So Father Chris Wallace and the pastor of All Saints in Haverhill. I got our associate priest here, Father Marcos, is with us as well. There's Father Marcos. So we have a Spanish community at a parish and an English community. I think, as Catholic priests and members of the Archdiocese of Boston, the Archdiocese has its own medical professionals who are, giving the priests and the churches in the Catholic diocese a lot of up-to-date information. I guess like from my perspective, I think one thing that would be helpful is to stop calling it the vaccine and refer to the vaccines plural, because there are several ones out there and they're not all created equal. We have I don't know if we can screen share, but in our bulletin the last couple of weeks, we've had something from the Archdiocese Connection, the label of the different vaccines that are either available already or in production, and their connection to certain ethical problems surrounding abortion, for example. But so I guess maybe refer to vaccines plural would be helpful part of the discussion, because there are certain ones out there which are not good and ethically from a lot of people's perspectives. I think that the other thing is the two vaccines that are out there right now, Pfizer and Moderna, are new technology, mRNA. I think I've been reading some things recently that it's not new as if it was discovered yesterday. Maybe the doctor could speak more about that scientifically, but I think it's the first time that this sort of technology is being applied on such a widespread scale. And so I think a lot of the hesitancy of the people, including myself, who ultimately did wind up getting the vaccine, my ethical concerns were satisfied in regards to Pfizer and Moderna and their connection to, ethically, bad sources. Johnson & Johnson, AstraZeneca, I wouldn't take out of moral reasons, but the personal concern I have, and a lot of people have, is that they have, it's the idea that this was new, certainly given the impression that it was rushed with all the politics behind it. And is it wrong to believe that it's anybody's guess what the any long-term effects of this might be? I guess that's where I would begin the conversation. Thank you.
Sure, absolutely, and I'll start. And I think that, that's very reasonable. I think that is reflective of some of the concerns that I think that we are all hearing. And as you alluded to, I think that while mRNA vaccines are relatively new and being deployed, this is technology that's been being studied and been in process for the last couple of decades. And I think that it's something that people have been working on for a long period of time. And then with the pandemic and with the urgency in the scientific community to try to come to some place where we could help save people's lives, then yes, this was developed more rapidly than vaccines typically have been in the past. But I think to me, it's sort of a blessing that this had been in process for this long period of time, such that scientists could then take it forward in the last several months to build something. And it makes it so much more difficult that there was, I think as a world community, we may not have responded to this pandemic in the best way that we could have. And I think that there are a lot of politics that have gone into all kinds of things. And I worry that because there were so many layers of politics, that may have shaded people's views of what was going on, one way or the other, in any direction. However, from a scientific standpoint, I think that this is something that people had been studying for a long period of time. And I think the kind of scientific expertise that was deployed in the interests of moving this forward was unprecedented. I don't think that there has ever been a push like this to be able to bring something forward into a place where it could address the needs of the world population in the past. I can't think of anything that was like this. So yes, it is true that it is not something that has been used a lot in the past. It is something that has been in development for some period of time, and that was worked on by, you know, a huge numbers of people in the scientific community over the last several months to bring forward. The thing that is reassuring to me about long-term side effects is the way in which this works, because messenger RNA, the way that it works normally in your cells is that after it is used, then it is degraded and does not stay there. So the vaccine works by having a small, it's almost like a little bubble that the messenger mRNA is delivered into the cell. It doesn't ever go into the nucleus, so it doesn't ever come near the DNA or the genetic material. And that recipe is used from the mRNA to kind of teach the cells of the body how to make one of the little tiny proteins on the outside of the virus, one of the spikes on the corona or crown of the virus, and how to make antibodies against that, so that the next time the body sees that, then it will recognize it and know how to fight it off. Once that mRNA has taught the body how to do that, then it's degraded and passes out of the cell and doesn't stay there. So while of course, you know, anything can happen, because this is something that is immediately used, the recipe to teach the body to make antibodies, and then it is degraded, that makes the likelihood of long-term effects that aren't seen quickly much less likely, because it isn't something that stays in your body or stays in your cells. The things that stay are the ability to make antibodies, which is somewhat similar to the antibodies that you would make after you have had a disease. So it's more similar than not to the antibodies that people have for at least a short time after they have had COVID and had the disease. Diana, Eli, do you have?
Yeah, I guess kind of just elaborating, one of the fears that I've heard expressed is that the messenger RNA will kind of change your DNA and stay in your body. And, you know, Kara had mentioned, you know, it doesn't go into the nucleus where the DNA is, so it can't do that. And kind of just adding to that, you've probably heard that there's really cold requirements for how the vaccine has to be, or vaccines have to be stored. And that's because it does very easily degrade. So just kind of going along with, it's not something that sticks around forever, but it does its job and it's done.
One of the other points that Dr. Marshall alluded to, so with all medications, all treatments, whether it be vaccine or oral medications, things have to go through phases. The phases for these two major vaccines were all done with appropriate testing and appropriate levels of individuals. And the reason they were able to be done so fast was through collaboration within the scientific community, because a lot of that political red tape was removed by the government. So it allowed people to share information across in regards to the genetic sequence, in regards to what sciences were working together and what was being formulated in those labs. The efficacy trials, you mentioned Moderna and Pfizer. I think those are the only current FDA approvals. I don't think AstraZeneca and Johnson have actually gotten their approval yet. But with Moderna and Pfizer, they have enormous efficacy, where it's like 94.5% for the Moderna vaccine and 95% for the Pfizer vaccine efficacy against causing immunity with 2 consecutive doses in the appropriate times. In terms of vaccine science, that's really unheard of. For the last 3 or 4 years, the flu vaccine has only had about a 40 to 60% efficacy. So the fact that we're able to convey that for our population is amazing, and a real testament to the scientific work behind messenger RNA. And as far as I can think back to a biology course, I've always learned about messenger RNA. It's not something that was new to me. I can remember high school biology and learning messenger RNA and transcription RNA and going through those phases. And When I was an undergrad, we learned about using messenger RNA as actually a novel treatment approach for cancer, if we can get it sequenced, but we haven't been able to get sequences like that to work. And then the one other thing is the volume of people affected with COVID actually helped move this forward. We didn't have to wait to find people that were sick or find people that had enough of a virus load where they needed to use studies or worry about transmission. We had that population ready available, which is something you don't typically have with things like hepatitis and HIV because the numbers are much smaller. So you were able to perform that type of trial.
I'm Ron from Common Ground. I'm the director of Common Ground in Haverhill, Ron Mills. And I have a question about the reactions. What are some of the reactions that people have been talking about? I know when we got the first vaccination, there was an ability to have an app which you could report any reactions that you're having. I have an interest in hearing what that might be with the first shot as also a comparison to the second one. And how is that unfolding locally and nationally?
Yeah, so it is common, you know, I think early on we were referring to these reactions as side effects, and we're kind of trying to refer to them more as an immune response because it's a natural expected occurrence as your body is kind of seeing this messenger RNA and kind of mounting the appropriate response to build the antibodies. And so it is pretty common to have some symptoms for typically only a day. For people who do get symptoms, the most common are headaches, body aches, fatigue, some people getting fever, but generally with Tylenol or Motrin doing pretty well, and for most people going away after a day. Because your body has already, if your body has already had some exposure, so for example, when you go to have the second shot, or if someone's getting vaccinated who had COVID previously, it can be that those people get a slightly stronger response. And so people with the second vaccine might have a stronger response. Not necessarily I know when I received them both times, I just had a headache and felt fatigued for a day. Some of my colleagues did have more symptoms than that.
I was going to say, I personally, everybody reacts differently to vaccines and to illnesses. So to say what is common, what is uncommon is a little difficult. For myself, when I got the first dose, I developed severe lymph node swelling. I had one on my neck and one underneath my arm. Both were about 4 to 5 centimeters in size, and they were both quite tender. But to me, that's how I knew the vaccine was working. I was actually really happy that I had that response because your lymph nodes are where your white cells, T cells, B cells, everything matures and replicates. And I am, as terrible as it sounds, whenever a patient comes to me who's had lymph node swelling from the vaccine, I'm able to happily say that they are having an appropriate immune response to it. The second dose, I became febrile. I had a fever about 102, and I felt like I was, I ran a marathon. My leg muscles were really, really sore. And those are typically what I've seen: fatigue, the swelling, and the muscle soreness. What we typically don't see is actual COVID symptoms. So any GI symptoms, cough or shortness of breath, those are the things where if you do have those with the vaccine, you should actually be tested for COVID and get that worked up, because it shouldn't cause any of those symptoms.
Thank you.
And a couple of the somewhat less usual things, I have seen people that had severe rash and arm soreness that didn't start until a week later. And I've seen where, so sometimes, most commonly, it is within the first couple of days out after the vaccine, but there are people that are seeing this delayed response where it's significantly later. I have had a couple of people that have had itching right after the vaccine, but that didn't stay or continue to develop anything else. I know the thing that you hear about that is the one of the most severe effects, and it is frightening for everyone, is anaphylaxis, or really severe allergic reactions. And given the millions of people that have had those so far, those are quite rare. And in comparison to allergic, and actually much less rare than with penicillin. So if you were getting a shot of penicillin, you are much more likely to have a severe allergic reaction than with than what we have seen thus far with the vaccine.
Thank you, Kara. I think I saw someone with a raised hand over here. Let's see. Is Mary, are you able to hear me?
Yes, can you hear me?
I can, yes. Is that you with your hand raised?
It's Mary Connolly with the City of Haverhill.
Hi, Mary. Thanks for joining.
Hi. I just wanted to comment on what we have seen for side effects amongst the first responders, first and second doses that we've done, as well as our senior citizens and other people within our community. And the people who had reactions were people who had had COVID within the past probably 3 to 5 months. What we did find was that they had some localized reactions. Some, it almost appeared that it woke the COVID back up, and they did feel pretty lousy for a period of 4 to 12 hours and then felt fine. What I did find with our seniors who maintained a good isolation was they didn't have any side effects whatsoever.
I've been hearing varied. I have some patients that have had very little, a lot of people that have had sore arm, some low-grade fever, and just feeling kind of droopy for 24 hours. But that's the majority of the reactions that I have seen.
I think also for most people, the reaction is definitely less symptomatic than actually getting COVID, both in terms of severity and duration. And so that's one way I like to try to encourage people who are worried about the symptoms.
Ron from Common Ground, how many people have been vaccinated in the greater Haverhill, Lawrence area? Excellent
question. I'm not sure I know the answer to that. I know within Greater Lawrence Family Health Center, I think that we are working on, I'm trying to remember the numbers from last week, but I would say 1,500, 2,000 just within our own system. I don't have the numbers for the community as a whole. I can try to find those and get back to you.
That's all right. I just wanted to have a general idea.
I mean, I know that those are just patients that we have, and then that was after the healthcare efforts. And I know healthcare workers, it is in the thousands in the region that have been vaccinated.
Yeah.
And Ron, I would add to that too. There's been an ongoing effort between, GLFHC, Stewart, the Holy Family, and multiple other community partners here in Haverhill, just to make sure that we can provide access to those that fall within that phase 1 and phase 2 criteria. I know for GLFHC, we just held the vaccine clinic this weekend, and we're able to provide 140 vaccinations within a short window. And that's just one section of many that have been happening within the community of Haverhill. So I can get specific Haverhill numbers unless the mayor is able to provide any of that information now. But I'm curious myself, and I'll definitely be circling back with you to give you an update on that as well. Thank you. In the meantime, there are a couple of questions that were shared with me, and Mary, you may be the appropriate person to answer these questions. I'm not sure, but I had an inquiry regarding, are the Council on Aging and Walgreens making second appointments, or do we have to go through the process of applying once again after the first vaccine's been issued?
I don't know the direct answer to that, but I know that the vast majority of places that they're doing the vaccine, they are making the second appointment at the time that the first vaccine is done. I don't know specifically, I can't speak specifically to the Council on Aging or to Walgreens, but I know that that is how it is being done the vast majority of places.
Great. Yeah, and I noticed that within GLFHC and some of the other sites that they're scheduling the second appointment right there on the spot. Another good question was how sure.
I know there are a couple of people with hands up too. We want to make sure we get to those.
Can you folks hear me now?
Yes.
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 Well, in answer to someone's question, there have been thousands of people in Haverhill vaccinated. I don't have an exact number because there's so many people doing it, but virtually every nursing home patient, every nursing home employee, employees of the various medical places. PMA has been a real leader. They've vaccinated around 2,000 people. So it's thousands of people. I think, Ron, you asked the question. I don't have an exact number, though. I wish I did. And I don't know if, to my knowledge, nobody's had to be hospitalized because of adverse reactions. And what I've been told, we had a great seminar run by Dr. Goodman at Holy Family for our employees. And what he indicated was about 30 million people have been vaccinated worldwide. Not a single person has died from the vaccine, but 2 million people have died from not having the vaccine. So it's pretty astounding.
Yeah, that's good information.
Mayor, I believe it's actually, it's more than 30 million now in the United States alone. So
Oh, it is.
much more than that worldwide.
You know, it goes up. I think the government's gotten a terrible rap for the rollout of the vaccine. The federal government, the state government. I actually think they're doing pretty well. I mean, nobody's ever done this before. There's no blueprint on how to go. So how many worldwide, Dr. Marshall?
I don't know worldwide, but I do know, I think the last number I saw was around 37 million for the United States.
United States. Pretty good in my opinion, but it's just an opinion.
Massachusetts alone has vaccinated about 1.1 million per the news this morning. So that's astounding.
We're all trying the best we can. We have clinics going at the Haverhill Citizen Center, and any of your parishioners that can't log in, we're very worried about that. Not everybody 75 and above has a computer access. And I call people every day. I meet some really sharp people, 75, 80, 85, who are on the computer, but not everyone is. We've set up some hotlines to help them. You can just have them call 978-374, Mary, correct me if I get the wrong number, which I did once, 978-374-2390. Or if they don't know that number or can't remember it, 374-2390, just call our 311 line, which is open from 8 to 4. Just call one call to City Hall, call 311, and we'll connect them to people that'll sign them up, put them on a waiting list, try our best to get them on one of the local sites, Walgreens, CVS in Methuen. Let me see, Mary, who else is doing them locally? Trinity over at the Burrows. Haverhill Board of Health when we have vaccine, which isn't always. Is Rafael back online?
I don't think so. I did want to add that the Greater Lawrence Family Health Center also is doing vaccine not only for patients, but for non-patients as well.
How could I have forgot? I just was there Saturday, and what a great job. For those of you that don't know, Greater Lawrence Family Health is in Haverhill. They are on Main Street, right next to Brothers Pizza, where Dunkin' Donuts is. They're a tremendous addition to our city. I think you did 140 just on Saturday, Dr. Marshall. And,
I believe so. Yes, I know they were having a big clinic on.
And what an impressive, building this is with all of the doctors. And I think they take walk-ins too. It's going to be a great, great medical addition to our city. Rafael is back, so I'll turn this back over to him.
Apologies, guys. I don't know what I missed. I actually lost audio and everything for a little bit here, but
we gave out your home number, Rafael, in case anyone needed it. By the way, Rafael De La Cruz has done a great job for us. He's on the Mayor's Public Health Advisory Council, as is Carmenza Bruff, who's logged in the middle of your screen under the name as I am of Rafael De La Cruz. And they've both done a great job in reaching out to the community and getting our minority community involved. And we thank them very much for doing that.
I don't know if you can see the hands up since you were kicked out.
Oh, I do actually. Apologies. Oh. Yes, thank you. All right, let's see if I can.
Another question.
Hi, yeah, I have a question. This is Cantor Vera from Temple Emmanuel in Haverhill, and one of my congregants, several of my congregants actually have asked, they're concerned that if they schedule themselves for the first vaccine, that there may not be enough for them to get their second dose. And I know there are some people who are really worried about this. So I'm wondering if the medical community and perhaps Mr. Mayor as well, you could speak to the availability of vaccine, how confident folks can be when they come to get that first shot, that there will in fact be the supply needed for them to get their second in a timely fashion.
I will say that I know that that the health center, and I think everyone is making it the top priority to ensure that those second doses are available. That said, can we 100% promise that we will be getting the vaccine from the state in the way that we need to? Probably not. But I know that everyone is working very hard to make sure that that is the case. And thus far, I don't know that there has been anyone that's, I have not heard of anyone having to miss the second dose because of lack of availability. Having to move it for a day or two, yes. When there's a snowstorm or when if the shipment doesn't come in, but not being able to get it, I have not heard of that happening thus far. Again, I don't think there's any way that anyone can promise with 100% certainty.
But as a corollary or as a follow-up, if I may, could you talk a little bit about how it works if one might have to delay a few days or even a week, like what that does in terms of vaccine's efficacy, what people can expect for that?
I think that the likelihood that a short delay like that would have an impact in the efficacy is very small. Again, it was studied with the appropriate window and time frame, so it's difficult to say, oh, it's been studied and you can delay up to this long. So it's extrapolating, but the likelihood that there would be problems from a short delay like that is small. I think that the fear is more around if were to have people having to delay months to be able to get the second dose, that would be more of a concern.
From what I'm told, Kenta, you have much more to worry about not getting the first dose, that you have an appointment and you just can't get it. But I'm not an expert on this, but from what I've been told by Mary and from state officials, if you get your first dose, you're going to get your second dose.
There is currently data to suggest you can be vaccinated within a 6-week window that was just released by Pfizer and Moderna. So the minimum time frame is 21 for the Pfizer vaccine and 28 days for Moderna. You don't want to be vaccinated before that. And then the extension on the CDC's interim guidelines was up to 6 weeks or 42 days past your initial inoculation. I don't think we actually have enough data to suggest that there is anything past that window until they go back and resample the people who were first vaccinated and make sure that everything's going okay.
Yeah, I would also to that say, I don't know, thankfully we haven't had to test it here yet, but I know my parents who live in another state, they were having issues with the second vaccine. And so what they actually did was use their supply only to give the second dose. And that week when they were low, they didn't give anyone the first dose. And so I don't think here we've had to kind of make decisions like that yet, but that would potentially be an option too if needed.
A question, what about folks who are choosing not to get the second dose? Have you had any people that have received the first and have not followed through with the second?
I'm not aware of any. Sorry, go ahead.
I was going to say, and I guess that would be because because we have Moderna followed by pound. And there is the 4 weeks between. We are still at the point where it is primarily people that were in congregate facilities and shelters or healthcare workers that are at the point of the second. And we are just going to be coming up on being able to begin giving our second doses to patients over 75. So I have not heard a lot about that yet. We will have to see going forward how that is and how people are. But I haven't heard anyone saying, "Oh, I got the first dose and I'm not going to get the second dose."
I think if you're wondering about efficacy after one dose, I only know the Pfizer statistics off the top of my head. They were just posted in a journal article in the New England Journal. So after one dose, it is 51% effective in the Pfizer studies, but there's no benefit to that. You get the full effect of the immunity after that second dose at 95% effectiveness.
Oh, Rafael.
Yeah, thank you, Eli. Ron, I see that it seems like you lost Mike over there. I'm trying to work on that on my end here. Bear with me 1 second, please.
No, and Moderna does seem to have the after the first vaccine, I have seen up to 80 or even higher percent efficacy after the first dose, and then continuing to increase with the second dose. So I think certainly if people are getting the first, I would not say you have to get 2 or absolutely nothing. If people, for whatever reason, are only getting the first dose, that is certainly much better than in terms of efficaciousness than not getting any doses at all.
Kara, one of the questions that I've been asked a lot is how long after your second, and you may have already asked this question when I ended up having mic issues here, but how long after the second dose is a person considered fully immunized or protected?
The CDC is using 14 days after the second dose, both for the Pfizer and the Moderna. That said, it's not like magically, you don't have anything and then 2 weeks after the second vaccine, then you immediately have this immunity. It is something that builds up slowly over time.
Thank you. So, okay. So there's no set timeline, so to speak, like 2 weeks.
The CDC is giving 2 weeks after, and I think that that's what a lot of hospitals are using as well, because hospitals are adjusting their protocols that they're using for testing people based on the vaccine as well. And I think that is, many hospitals are using that 2-week cutoff, that if you are 2 weeks beyond your second vaccine, then your likelihood of having COVID is markedly less than in the unvaccinated population.
There was one question my daughter wanted me to ask because she just had, her baby had the corona, and she just went through it. But she wants to have more children, and she's worried about fertility. And I think you answered it by saying that it does not affect the nucleus and does not affect the DNA and genetics. But I just wanted to make sure on the question of fertility, she was worried about that. Have you seen anything stating that they could affect that in any way?
Well, there was something that came out that led to that. So there was someone that I think that had worked at Pfizer. There was someone that started this idea. And they started that based on the idea that there is the vaccine causes the body to make antibodies to that little bit of the spike on the coronavirus, and that there is a tiny bit of similarity between that and some of the proteins in the placenta. And so the concern is that would somehow impact fertility. That overlap is so tiny that there really is no scientific evidence that would cause an issue. If that were to cause an issue, because there are so few proteins that are shared, that if that were something that were going to cause a problem, we would be seeing problems with all kinds of things, because there's also enough of those tiny proteins that would be shared in your liver and your heart and all over your body, that if this tiny overlap were enough to cause problems, we would be seeing much more issues than we are. The other thing is that people that have already had COVID have developed antibodies against these spike proteins as well. And we haven't seen any issues with fertility in people who have had coronavirus either. So if that was something that was going to be an issue, we do have actually a significant population of people that we can already see seem to be not having problems. There really is no scientific basis for concern. And I can say I have a 15-year-old daughter. When it is possible for her to be vaccinated, I'm going to have her vaccinated with absolutely no concern. And she's my only child, and if she chooses, I hope to have grandkids. So,
well, I got 6 and they're wonderful.
Ron, I see you back on.
Yeah, I've lost the audio 3 times.
Yeah, I'm not sure what's happening with the platform, but yeah. So, did you want to ask a question of our team?
No, I'm just sorry I missed some of the dialogue.
Well, this is recorded, so
Yes,
refer to it later on if you wish.
That's what I'll be able to do.
Cantavera?
Hi. I wondered, I think it would be helpful for people to hear the clinicians talk a little bit about what is safe to do and not do after your second dose, after that's fully effective. What kind of behavior is still recommended? What is possible in terms of changing the way we've all been, God willing, trying to mask and distance and keep ourselves apart?
So for right now, sadly, there's not a lot of change. There's because we know that it protects us from getting COVID, but we can't definitively yet say it prevents us from transmitting to other people. And so with that, we really need to still wear a mask, do the social distancing. You might have also heard a little bit about the different variants, newer variants that are popping up, and to what extent the vaccines are protecting against them, we'll need some more time to learn. So really for right now, it's, I think for all of us who've received it who are working, when we have accidents with our PPE, we have a little more relief, but for right now, we really still need to do social distancing and wearing our masks.
One of the things to remember is that although that the vaccine will protect you from hopefully a terrible case of COVID, you still can transmit the virus back and forth between people, and that's the biggest sort of risk. The latest guideline from the CDC was people who have had their second dose and are outside that 14-day window. If they've had an exposure, they no longer need to quarantine. That was, I think, Friday's major breakthrough. But as far as social distancing and masking goes, I don't think those have changed yet.
I think that there probably can be, I know with families, I know there are many of us as healthcare workers that are hoping to, who may have elderly parents that are hoping to be able to see them once everyone is vaccinated in a way that is where there can be a little bit more comfort and a little bit less fear. So I think that there will be small changes, but overall, large changes in what we're able to do in public are more difficult until we have more information. Because the goal is to continue to keep the community as safe as possible.
I see that Reverend Young has his hand raised. I want to recognize Reverend Young.
Yes, thank you all for doing this evening. I just have one quick question, maybe two. But I guess I wanted to know, do you know the vaccination rates for different races, such as who's been vaccinated, how many of the percentage of African Americans, Latinx, and so forth? And then as leaders of churches and organizations, what is it that you all are asking of us to help our parishioners complete their vaccination?
So absolutely. So I don't have, and I don't have numbers for the local community at all in terms of total numbers of people. So I also don't have the breakdowns in terms of Latinx, African American. However, I do know that there are marked disparities in people's mistrust and comfort level with the vaccine, and that people who have Latinx and African American heritage when studies are done, are less comfortable with being vaccinated. And I know that comes from a very long history of very warranted mistrust. And that's something that we will have to continue to work to be able to break down. I know our hope in the local community is to work to do everything that we can to get everyone the information that they need to be able to make the best decision that they can for themselves personally. And if they are concerned or have lack of trust, to be able to have the opportunity to ask questions, to get answers, and to have a conversation about that. And I guess as leaders of the community, that would be my hope, is that we can all help to facilitate conversations. If people have questions, and they're questions we can't answer ourselves, to connect them with people where that can be answered. We're looking to speak to as many people as we possibly can. And because it's hard for us to speak to every one of our patients individually, we're looking to speak with community groups and community leaders like we have in the room today, in order to be able to get that information out there and to make sure that everyone has all of the information that they need to make the very best decision possible for themselves, for their families.
I know within our clinic, when we had the opportunity to get vaccinated, there were naturally some people had a lot of hesitancy in the beginning, and there were certain leaders within some of those groups who, once they decided to get vaccinated and were kind of vocal about it, a lot of people who had early on kind of reservations followed them. And so I think part of it too is kind of being a leader and open with what your thought process is and what you're doing, and appreciating that, the people in your churches that matters a lot to them, what your thoughts are too, and the example that you lead to.
Of note with the study, so if you look at the total US population, for individuals who identify as Black, it's about 12.8%. In both studies for Moderna and for Pfizer, it was about 9.8 and 9.6% of the trial participants that were Black. And then for Hispanic and non-Hispanic, although that is more of an ethnicity and a lot more complicated to measure, overall US population is about 17.6%, and there was 20% in the Moderna and 20% in Moderna and 26.2% in the Pfizer trials. That represented those populations. So they mimicked, or they tried to mimic the US population as best they could. I can share the table if I can share screen that I'm looking at the moment.
Are you asking clergy or leaders to take vaccines? I have colleagues in Boston and other places where they've tried to do their best to push leaders and clergy to take the vaccine so that their parishioners would feel comfortable with taking the vaccine.
Yes.
Thank you, Mayor.
And I think that for those people who are comfortable, I think that having the sharing that, I know many of us did pictures when we got it, and I think that sharing those pictures for those people who feel comfortable can be very powerful, because I think that there are, as community leaders, there are a lot of people that trust you, and that image can be really powerful if that's something that people were to be comfortable with.
I was at a seminar from the U.S. Conference of Mayors, and they asked people who they trusted. The two most trusted groups was the children's doctor, pediatricians, and clergy. Unfortunately for me, the least trusted group was politicians. So we need your help if we're going to be able to persuade people to take the vaccine. And particularly we need your help in the minority community, where for very, very good reasons, there is a lot of mistrust of government. And believe me, I understand that. Thanks.
Yeah, I know one thing that my church is doing, Pastor Adi Roldan is doing a similar webinar to this, kind of at the time where we normally have our adult Bible study, to kind of let people have their questions addressed as well. So similar, just information sharing as well.
Thank you. This is, it's a lot of good information. I think kind of circling back to you, Reverend Young, as well, with your question. I think, and as the mayor mentioned as well, being a spiritual leader in the community and being one of the most trusted individuals when you look at the census that was done to see who's most trusted in the communities. I think, you guys have a vital role to play in this as well, just like the doctors, as far as education goes. I mentioned at the beginning of this meeting that the hope for what we wanted to achieve here was just to equip you with the knowledge that you could take back to your congregation should any one of your members want to come up to you and ask questions. And I think that's important. I think you guys have a key role to play in sharing the knowledge that you've received. This isn't a push to force something onto someone, but more to equip people with the knowledge that they're going to need to be able to make their own decision as to whether they do or do not want to move forward with the vaccine at some point. So, I really hope that the information that you've all received today has been very informative and helpful. And, if you have any other questions that perhaps some member from your congregation asks, even after this meeting, certainly feel free to share it with me, and I'll be happy to take it with the clinicians.
And if any of you need our help in doing a video, I've assigned Sean Reagan from the mayor's office. He's already done 9 or 10. I think Reverend Young has signed up to do a video. And You're welcome to do them on your own and share them with your congregation. If you'd prefer to have our help, we're happy to do it. Just call me at the mayor's office. Any questions that you have about what the city's doing, give me a call. My cell phone is 978-265-7049, or call me at the mayor's office. Happy to answer any questions at all.
Wonderful.
Thank you. Ron, did you want to say something? I'm sorry, I thought I heard you.
No, I was just thanking the mayor for that.
I don't see any other questions, Rafael, so I want to thank everybody for joining us, and we need your help if we're going to be able. My goal is to have 75% of the city vaccinated by July 4th. It's a very ambitious goal. We've got a wonderful team going, and we need all of your help. If any of you have any questions, concerns, please give me a call Rafael, and I know we'll be able to put you in touch with medical professionals also. So thank you all very, very much for joining, and I'm going to log off, but thank you all very much.
Mayor. All right.
Thanks, Rafael.
Thanks.
Great job, Rafael. Thanks, folks.
Thank you, Mayor. Anyone else have anything for the doctors before they log off? All right. Well, Dr. Marshall, Dr. Eli, and Dr. Smith, I want to thank you guys for taking of your time to share with us. Truly, truly appreciate it. And thanks for everything you guys do as well.
Thank you.
Thank
you
you.
for organizing this.
Thank you
Thanks,
folks
guys.
very much. I appreciate the time and the information a lot.
Thank you. Thank you.
Thank you, Rafael.
You're welcome. Have a good evening. And again, this video is recorded. If any of you wish to have a copy of it, we can certainly share it with you.
Thank you.
All right. Take care.
Good night.
Night.